So there's a couple categories of symptoms that we're looking for when we're considering autism as a diagnosis. The first one is a social cluster of symptoms. So sometimes this is a lack of social interest, but sometimes it's a little different in that you might have a child who has a lot of social interest, but doesn't quite know how to engage socially. And then also sometimes there's this lack of social understanding. So not understanding maybe gestures. The classic one we think about is lack of eye contact, especially with younger kids, or trouble making appropriate eye contact. So the second thing we think about is a category of symptoms called restricted interest and repetitive behavior. So the first one's pretty self-explanatory. Restricted interest are when kids are really one-minded on one thing. For some kids, it's a really typical thing, like video games, but they might be interested in a different kind of way. The restricted interest, though, can be a little bit more unusual, so maybe a child's really interested in flagpoles. Repetitive behaviors are also something that stand out quite a bit for kids on the spectrum. Some of the common ones we see are things like hand flapping or other hand mannerisms. But then there's also repetitive language that we see in a lot of kids. So those are really the two clusters of symptoms we're looking for. But I think some of the early red flags that we see are that lack of eye contact, sometimes lining up toys. But those are some of the earlier, more obvious symptoms that not all kids show, but most kids have some type of developmental history of those symptoms.